People ask me a lot about fat grafting. And the truth is that when I was doing my residency in 1904, we used to we used to not think much about fat grafting. As a matter of fact, it was something that was considered temporary and just a filler that would go away eventually. But it was thanks to Dr. Sidney Coleman in New York that we all learned how to do fat grafting the right way. And it's an incredible operation that helps out in many, many ways. Fat grafting can help out with scars, it can help out with aesthetic procedures. For instance, very commonly when I do a facelift, I would use fat grafting to enhance the volume. Because with aging, we lose a lot of volume, and that's what makes the skin sag. So when you tighten the skin, put it back where it should be, then you still have that loss of volume on the face. And fat grafting is the ideal way to restore that lost volume. And it's amazing the amount of rejuvenation that you get by restoring volume with fat. Fat also, as a cellular graft, has the ability to induce improvements in the quality of the skin. That's why it's used very commonly in reconstruction. Well, the fat grafting surgery is something that is done generally with another surgery. For instance, you're doing a tummy tuck and you want to enhance the buttocks, so you take the fat from the tummy, put it in the buttocks. So that's one surgery. Now, sometimes we're going to restore breast volume and there's no really good donor sides. So we sometimes look at the arms, and sometimes the arms are a good source of fat. The trick is that fat has to be harvested in a certain way and has to be re-injected in another specific way to ensure the maximum take of the graft or function of the graft. The fat usually takes in about 60 to 70%, sometimes more, sometimes less. And that's what you should expect for a result. Now, how long does it take to recover from that? It depends on the associated treatment that you're doing at the same time. For instance, the other day, yes, I had a patient of mine who I had removed her implants and did some fat grafting, but she wanted more. And in cases like that, you have to see whether the patient has good sources of fat, because you don't want to over resect or take too much fat from the donor side and cause a problem in another place to fix this place. That's not good. That's not good medicine. So you have to always be very selective of your donor sides so you don't cause any additional problems. Risks from fat grafting. Yes, there's definitely risk associated to fat grafting when it's done improperly. And this is something that has transpired in the past in other countries and also in our country, particularly in the area of Florida, where fat grafting has been done not following the correct procedure that needs to be done. And fat can be very dangerous when injected into the circulatory system, particularly into the veins, and it goes to the lungs and produces thrombus there, or fat emboli, which is could and can be a deadly problem. Now, the ASPS, the American Society of Plastic Surgery, had appointed an ad hoc committee to study these problems of fat grafting to the buttocks that migrate to the circulatory system. And they've concluded that injecting fat into the buttock muscles is very dangerous because it can easily break the veins in between the muscles and migrate into the circulatory system or bloodstream. So there are some recommended ways of doing the fat grafting, and one is to use a large cannula and use vibration and inject it only in the subcutaneous tissue. Never try to inject into the muscles. And we've seen that allows for a safety use of fat grafting. Oftentimes I hear my patients when I tell them, okay, you're a very good candidate for fat grafting, they go, but isn't that dangerous, doctor? And the answer is yes, it can be very dangerous when done improperly in untrained hands. I have never had a patient that developed such a complication as intravascular injection of fat. And I've used a lot of fat grafting in the face, in the breast, and in the buttock areas. One of the very important applications of fat grafting is for breast reconstruction after cancer, because a lot of the patients that have breast cancer receive radiation to the breast, and that changes the tissues permanently. So the skin becomes very hard and pale, and it looks burned. Now with fat grafting, you can manage to change the biology of the skin in a reconstructed area and make it soft again so it looks and feels like a normal breast. It's amazing what it can do. Now for cosmetic uses, I use it a lot in the face, as I said, in order to restore volume. You can use it in hands to cover those tendon and veiny looking hands of old people. And another place I use it is for breast corrections. I don't do reconstructions in general. I do a lot of cosmetic breast surgery. And sometimes we have adverse results. Sometimes we have asymmetries to correct. And sometimes we want to get rid of old implants and restore some of the volume loss from that. For all those reasons, I love to use fat grafting because it's your own tissue, it's live tissue, and when it takes in place, it functions as a rejuvenating agent. One of the very important uses of fat is in body contouring, especially people that have tummy tucks done at the same time. You can use all that fat harvested from the abdomen and from the upper and lower back and use it to enhance the contour of buttocks. So buttock enhancements are done with fat grafting in a very satisfactory way. So fat grafting to me is almost miraculous, all the things you can do with it.